A new Stanford Medicine study took a closer look at COVID-19 infections and the cells that likely get infected first. Joining me now is Dr. Malathi Srinivasan with Stanford Healthcare. Thanks for joining us this morning. What did the study find?
And what we found is that the COVID-19 virus is entering through one of the most common cells in the nose and in the upper airways. These are cells that are called ciliated cells that have little beating hairs that normally would sweep the virus out of your body. But instead, the virus is infecting them and is really destroying their ability to do their job. So not only are you going to be more likely to get infected through very common cells, but it's also downregulating your immune response. And what this really means is that we need to be even better about wearing our masks and wearing our masks over our nose. I'm sure you've been outside and you've seen people walking around with the masks almost kind of halfway off someone's nose, but the virus is entering in through the nasal passageways, infecting those nasal passageways. So we have to be much better about mask wearing and mask positioning than we thought we did.
Now, the study also looked at hypertension drugs and if that has any relation to the risk of infection. What were those findings?
This is really good news for everybody who has high blood pressure. Initially, we had thought that because the COVID-19 virus comes in through receptors that are blocked by some of the most common hypertension drugs called ACE inhibitors and ARBs, that people who had hypertension were more likely to get infected because there was a fear that in people with high blood pressure, those receptors were expressed more, meaning there were more of them. What we're finding, though, is that's not true. Just because you have high blood pressure doesn't mean that you have more of these receptors on your in your blood vessels or in your nasal passages. And that's good news because it doesn't provide more targets for the COVID-19 virus to hold on to and infect. This is really important because this particular blood pressure medication in the category of ACE inhibitors and angiotensin receptor blockers have been shown to decrease mortality in people who have diabetes and heart failure. It's one of the first drugs that we use when someone has a heart attack. It prevents progression to kidney disease in patients who have diabetes and a little bit of kidney damage. So it's a very important set of medications to use. And people are very afraid that if they use this medication in the pandemic, if they have high blood pressure, then they would get more sick or they'd be more likely to get more sick. And we know now that that's not the case.
Okay, that's good news. Now to the stay-at-home orders, a lot of controversy over this. How do you think the ban on something like outdoor dining will impact the number of coronavirus cases around here in the Bay Area?
And I really hope that this measure is going to help us bend the curve. Now, a ban on outdoor dining alone is not enough to be able to drive down our numbers. What we need to do is have this as part of a larger plan to be able to limit our contact with people who are outside of our immediate household. And that's what the ban does. The ban has been triggered because it's projected that within about 3 weeks, Northern California's ICU bed capacity is going to be less than 15%. We know that it's already at about 5 or 6% in the San Joaquin Valley area and about 10% or so in Southern California. And this is the surge that we're seeing after everybody wasn't careful over Thanksgiving. 2 or 3 weeks later, here we are. So if we don't do something that's going to be very stringent, we are going to exceed our capacity to be able to take care of people and really try to give people the best care that we can when they get sicker so that they can survive these infections. So my hope is that this will really bend the curve. It has to be part of a comprehensive strategy. And so just doing this on its own is not enough.
All right, now we are just starting to get the first COVID-19 vaccines here in the Bay Area. What would you like to tell people once, our time in line comes up and it's time for us to get a vaccine?
What I'd like to tell everyone is first, please get your vaccine when it's available. There's going to be a limited supply initially. We didn't order enough from the large manufacturers earlier on. But the Pfizer and the Moderna vaccine are coming. And in California, we're very excited about this. When people get the vaccine, there's going to be a small percentage of people, maybe 10 or 15%, whose immune response is going to be very robust, meaning they're going to feel like they've got the flu, their arm's going to be really sore, they might feel achy for a couple days. But what that's telling you is that your body's doing a really good job about recognizing the viral particles as not being part of you and as being something that's an invader that they've got to fight. So these vaccines so far are very safe. The ones so far require 2 shots. So what I'd want people to do is first make sure you get your vaccine, make sure you get both doses for the Moderna and the Pfizer vaccines. And then please wait a month or so, because we have to make sure that people have had enough time to build up that immunity and all the antibodies they need to fight the virus if they should become infected.
Now, from what you understand, will this, if you get the vaccine, will it allow you to still pass it to other people, or are you totally free and clear at that point?
I think that's a really good question, Anne. I don't think that we have the answer to that. I think that that's something that we'll have to wait and see. The likelihood is that you will clear the virus faster and that you won't get as sick if you do get sick. I don't think this is a guarantee in any way that if you initially are infected and your body's fighting the virus, that you can't pass it to someone else while your body is in the process of fighting the virus. The most likely scenario is that you will have less virus around, you will be less likely to pass the virus, but it's probably still likely to happen. So I think that until we have a very large number of the population completely vaccinated with their series of vaccines, that it won't be safe to drop a lot of our social distancing and our other standard measures that we're using to be able to prevent viral spread.
And one more question as holiday travel comes up. Say somebody already had the coronavirus. They tested positive months ago. They've gotten over any illness they might have had. Is it safe for them to go travel for the holidays?
It's safer for you to travel if you have already gotten coronavirus, but I don't think that there's no risk. If you do have it, again, there's still other people who you could pass it to if you had a mild infection. So although it may help you, you still need to be careful, because as sort of citizens of the world and citizens of the Bay Area, I think we need to do our best to protect each other.
Okay, so you're saying you could pass it on. This is actually a specific question coming from one of my friends who has run into this whole scenario, and she's like, I can go visit my parents now. And I'm like, can you?
No. If you've had coronavirus, that means that you probably have antibodies to protect yourself from getting severely ill, because your body has already recognized the virus as foreign and has built up, hopefully, some antibodies, but we don't know that's true for everybody. And the more mild your illness, the less of a robust immune response you would have had, so the less antibodies you would have. So you can still get infected while you have coronavirus, even after you've had coronavirus, and you can still pass that along to others. So you might not get as sick, but you can make someone else very sick. So I would advise that if you're going to travel, that they need to be very, very careful and should really think about it. We're advising most of our people not to travel until we have a lot of people vaccinated. So if at all possible, we would urge people just to stay home.
All right. Thanks for all the insight, Dr. Malathi Srinivasan with Stanford Healthcare. We appreciate it.
Well, thank you so much, and it's great to see you.